Right, so our next speaker is Rebecca Harding from UCL, and she's going to talk to us about a survey on the problematic ketamine use and addiction. Thank you.
Hey, can you hear me? Hey. Okay, so I'm going to be talking about something a little bit different. I'm going to be talking about the preliminary findings that we have for a survey in problematic users, trying to gauge their attitudes towards ketamine and about the treatment options that are available for those that have problematic ketamine use. So obviously, we all know what ketamine is and that it has significant clinical potential, but at the same time, ketamine has a very strong abuse potential, and its use outside of the medical setting in more recreational settings has spread across many parts of the world. And several addiction treatment providers that I've been speaking with as part of my research have expressed that a lot more people are seeking treatment for problematic ketamine use. And this really underlines that there is a need to better understand ketamine addiction, including the motivations behind ketamine use, as well as gauging attitudes to develop more tailored treatment approaches for better outcomes for problematic ketamine users. And so we conducted a survey which sought to capture the attitudes of these users and to learn the best ways to treat it. So this was an online survey that asked users about their attitudes towards ketamine and its addictive properties, the physical and psychological symptoms of their ketamine addiction, and attitudes towards the addiction treatment approaches that are currently available. And we wanted to capture the opinions of both treatment-seeking and non-treatment-seeking problematic users over the age of 18 who were fluent in English. And this has been distributed via addiction treatment services, predominantly Change, Grow, Live and Humankind, who are based in the UK. And we also distributed this via Reddit and Facebook groups. And we've used a combination of quantitative and qualitative approaches. And as I mentioned, the results that I'll be showing today are preliminary findings as the survey is still open. So far we've collected 371 responses, and 285 of these respondents report having a current or previous problem with ketamine, and this was self-identified problems. And most of this population, around 3/4, are from the UK. And 59% of our sample had a mental health diagnosis aside of their problematic ketamine use, with 59% of the sample that has a mental health diagnosis being diagnosed with depression or anxiety. The average age of participants was 28 years old, but although the average age when they first tried ketamine was roughly 19. And the majority of findings were through, they found it through friends, although 4 respondents actually found it through having a clinical prescription for ketamine. Insufflation was the main method of consumption in 93% of users. And the majority of people who filled out the survey said that ketamine was their primary drug of choice. So we asked respondents whether they think there is currently enough awareness in education and amongst their peers around issues associated with ketamine use. And 59% of problematic users who responded to this question said there was definitely not enough awareness of the issues associated with ketamine use, and only 3% responded saying that there was enough. We conducted qualitative analyses of this question, of the responses to this question, and the most common theme was that there is a lack of information about problematic ketamine use and a lack of information about the physical implications it has on your organs, such as your bladder and your kidneys, and there was a lack of awareness about its addictive potential. 4% reported that there is not enough awareness in healthcare professionals about its addictive potential, and with many saying that when they've sought help from their doctor, that they're not taken seriously enough because they're not aware of how addictive ketamine can be. And interestingly, a small number of respondents said that ketamine won't solve problems with mental health and that the clinical advancements may contribute towards addiction. We also asked respondents about their initial motivations for taking ketamine and how that compares to their current motivations now, with the most common reasons for beginning taking ketamine being the dissociation, the psychedelic aspects, the general high feeling, and self-medicating. Compared to the main reasons they use it now, again, it was topped with dissociation, but self-medicating came higher up in the reasons why people chose to use ketamine. When we asked about their experiences during a period of abstinence from using ketamine, the 4 most common symptoms were cravings, low mood, anxiety, and irritability. And less common symptoms included physical symptoms of withdrawal, such as poor appetite, sweating, shaking, heart palpitations, and some had tremor as well. Participants were also asked about any physical symptoms associated with their problematic use, so that's not during an abstinence syndrome. And 13% said they didn't experience physical symptoms, but of those that did experience physical symptoms, 60% said that they suffer from bladder problems, 60% had problems with their nose, 56% had what they call K cramps, which are severe abdominal cramps, common in more recreational heavy users of ketamine, and 17% reported headaches. Some participants also reported issues with other organs, such as kidneys and gallbladder. And in response to these symptoms, the majority, 56%, did not seek treatment, but those who did, only 36% were satisfied with their treatment experience. So moving on to ketamine use disorder itself. We asked participants if they'd sought treatment for their problematic ketamine use, and around 40% of respondents had. And of those who had sought treatment, 38% had sought treatment once, but 16% had sought treatment 5 or more times. The most common treatment users had tried was outpatient therapy, but most said that support groups were more effective in helping treat their problematic ketamine use. And 13.5% of this cohort said that they didn't feel like any treatment was effective for helping them overcome their problematic ketamine use. We also asked participants if they felt that the treatment services that they went to were aware of ketamine addiction, with only 3% saying that providers were extremely aware of it. 43% said that the service was not tailored towards their ketamine problematic use, and 11% said that the treatment was very effective at treating their ketamine addiction. And here is just a quote from one of the survey respondents who, when asked about their motivations to quit, they say, "I lost all of my close friends, my partner, my house. I had £2,000 debt at the age of 19, dropped out of college 4 times, I ruined my life, and I just had enough." So, really has the potential to severely impact people's lives. And so to conclude, I think our results underline a need for better education and awareness about the negative effects of ketamine use and its addictive properties. It shows that there is a need for improved tailored approaches to treating ketamine addiction and support for the physical symptoms associated with its use. And we really hope that the results from this survey will guide the development of new treatment approaches for problematic ketamine use and guide further research into ketamine use disorder. And I'd just like to thank my collaborators at the University of Exeter, Emily over at the back there, as well as Humankind and Change Grow Live, who helped us distribute the survey to problematic users in their care. Thank you.
Thank you. We have time for a question. Marco? Thank you, Bar.
Really interesting work, thanks. Did you collect any information on the sorts of doses that people are taking and if that was at all associated with any of
Yes, I did realise as I was about to come up and give this talk that I forgot to include any of that data, but we did collect dosage that people would report. It was pretty heavy. People often using grams a day. Of course, the purity of that is also variable. But yeah, as I said, these are also preliminary findings. So when we do report that, but some of the range of dosages that people were consuming is huge. But the majority are using grams every day.
Thank you so much, Rebecca. Honestly, very important work. One of my questions is, did you collect any information about whether they were poly users? And if they were poly users, what other drugs were most common in combination with the cat?
Yeah, that's a really good question. I don't know off the top of my head what other drugs came top, but we did ask them what other drugs they used. But as I mentioned, the majority of respondents did say that ketamine was their primary drug of choice. But I think cannabis was also quite high up there. But yeah, I can't remember off the top of my head. But yeah,
That'd be really interesting to know.
definitely.
There was like a type of person who typically alongside cat takes like other drugs that are maybe similar in association like that, rather than like.
Yeah, definitely. Yeah, one of the findings which I haven't reported here, but one of the motivations that people reported using ketamine was for the spirituality aspect, which I thought was really interesting because that is something that's not really common in other types of drug addiction. But yeah, it's really important to think about.
Thank you very much for thought-provoking talk, and it's also a bit disturbing, I would say. Given that we had this debate and talk about home use and how we communicate about ketamine and its all the good things it may do for people with severe mental illness, are there lessons that you can sort of derive from this survey, even speculative?
It's so difficult because obviously self-medicating was a big motivator, and I spent a lot of time on Reddit on some of the forums there, and I got quite a lot of hate for sharing the survey on one of them, which was the therapeutic ketamine forum, and at the same time on the ketamine addiction forum I received a lot of praise for the work, but on the therapeutic ketamine forum I received a lot of hate saying that this was their savings, or what saved their lives. So it just showed the difference in how the attitudes of people that are struggling with it and that also are, is what's saving them from their depression, anxiety, and everything else. So yeah, it's really difficult to say. Obviously, it is so important and it really can save lives, but it can also destroy them, as we've seen with our results. So I think it's just education, awareness. I think that is the main thing, really. That's how, if ketamine is to become a lot more widely available, yeah.
Right. Well, thank you very much. We move to our next speaker. Oh, okay. So, Dr.